Welcome everybody, and thank you for joining us for this very special virtual reunion concert. I'm Professor Alistair Sloan, and I'm the head of Melbourne Dental School here at the University of Melbourne. Before we start, I would just like to acknowledge the traditional owners of the land on which I sit, which is the same as the university, and that's the land of the Wurundjeri people of the Kulin Nation. And I pay my respects to their elders, past, present, and emerging. I'm very excited to be opening tonight's virtual concert event and welcome you all here to mark your reunion in 2020. I'm even more excited because until I arrived here in Melbourne, I'd had a parallel life as an academic, as also being a professional saxophonist, so music's very much close to my heart. And tonight's incredible performance has been created exclusively for Melbourne Medical School and Melbourne Dental School alumni, as a collaboration with Corpus Medicorum, Melbourne's orchestra of doctors, dentists, students, and health professionals. The concert features an exceptional violin soloist, Markiyan Melnychenko, and pianist Stefan Cassomenos, who have both performed as soloists before with Corpus Medicorum. I hope you enjoy the performance, and you can join me in its conclusion when I'll be talking with Corpus Medicorum double bass player, one of our dental alumni from here at Melbourne Dental School, Dr. Malcolm Griness. Have a great evening and enjoy the concert. Welcome everybody, all our alumni, to this wonderful virtual reunion concert. And we have alumni joining us from pretty much a lot of our cohort groups. We have students, ex-students here from the 10-year cohort through to our 50-year cohort from 1970. And many also from our Apollonia cohort. And I'd like to make special mention to John Harcourt. John, who I've got to know over the last 10 months, pretty much virtually more than anything else, is joining us here tonight. Most of you will know him, of course. John graduated here from Melbourne Dental School with a Bachelor of Dental Science in 1953 and is celebrating an outstanding 67 years of an incredible career in dentistry here at the University of Melbourne. So congratulations, John, and congratulations to all of you who are celebrating a milestone year since your graduation with us, and thank you for joining us. I'm Professor Alistair Sloan. You saw me right at the start of the concert, and I'm the head of Melbourne Dental School. I'd like to welcome a few other guests joining us this evening. I'd like to reference, of course, and really recognise the Reunite online programme, the team behind all of this. This is our first ever digital reunion programme for the faculty, and I think it is becoming nothing short of an outstanding success. But joining me this evening for a conversation this evening is Dr. Malcolm Grenest. Malcolm is a double bass player in Corpus Medicorum, and he's joining us from Hobart in Tasmania. John, though, is a graduate of Melbourne Dental School and was raised and educated here in Melbourne. And in the 1990s, studied for fellowship of the Royal Australian College of Dental Surgeons. He's had a long and very distinguished career as a dentist, but has undertaken a significant amount of research in his career to date. In the 2000s, he really undertook a great piece of work as a PhD in spatial science, looking at a particular dental problem that's probably eluded most of us who research in this field for about 20 years, namely the high-resolution 3D modelling of teeth using off-the-shelf camera that you can buy generally in most camera shops in shopping centres around the country. I also would like to introduce to you all Cecilia Dowling. Cecilia works in advancement here in the faculty as an alumni relations officer and has led the annual reunions programme in the team. She's put a lot of this programme together. She directed all aspects of the virtual reunion concert this evening, including finding suitable venue, selecting the music, commissioning the musicians, organising the video and the sound recording and all the logistics. A very difficult task given all the problems we have with COVID and the pandemic at the moment. But outside of her work, she is actually a musician and has just completed a Master of Music performance at the Melbourne Conservatorium of Music and is a viola player by trade. And probably, you can probably tell from what she's done so far, music is without doubt her passion, as it is mine. And it's great to be able to do this concert for you this evening. Ceci, welcome and congratulations on bringing this wonderful program together. From my perspective and from our perspective, all of us tuning in, it's appeared very seamless and a perfect piece of work, well done. But I am sure there is a lot involved in coordinating the entire concert and bringing this to bear now, given all the restrictions we've been living with. I mentioned you've done all the logistics and all the behind the scenes work, but give us an insight of how that's all come together and what you've done to really get this to the screen this evening.
Well, thanks for the introduction, Alistair. Before I tell you a bit about the concert, I'd like to thank all our alumni who are here tonight, particularly the reunion champions who helped inspire the program that we have put together across the weekend for Reunite Online. What started out as a fairly simple plan for a recording to present tonight became increasingly challenging in proportion to the changing restrictions in Melbourne. I was in touch with Director of Corpus Medicorum, Mr. Philip Antippa, earlier in the year about somehow celebrating the connection between Corpus Medicorum and the faculty. As an orchestra of doctors, dentists, and health professionals, many of our alumni play in Corpus Medicorum, including Philip Antippa and Malcolm, and many alumni watching tonight will have been to their concerts in the past, so we wanted to develop that connection. And when our on-campus reunion weekend was postponed for the year, we landed on the idea of showcasing Corpus Medicorum through a virtual concert for our milestone reunion cohorts who are with us tonight. Normally, a recording would be a fairly straightforward process where a set number of players perform some pre-planned repertoire. But the concert you have just seen took on many different shapes over the past couple of months, shifting to accommodate the guidelines for coronavirus restrictions for performance venues, which coming out of stage 4 restrictions in Melbourne was hard to predict. The recording was scheduled for after stage 4, but none of us knew exactly when that would be or how many people we could have in a room. Our original plan was to record with 20 players with a full combo of instruments, including woodwind, brass, and strings. That became 20 string players when venues were asked to avoid instruments involving breath as a risk for transmission. 20 strings became 10, then 5, and then we were looking at a duo, which is when Stefan was able to join the program on piano. The music we chose shifted and changed too, of course, as did the venues. And finally, we landed at the Athenaeum Theatre in Melbourne CBD with the string ensemble of Corpus Medicorum players, including the director, Philip, on viola, on standby to play a special arrangement of the Lark Ascending if possible. We only got the green light to go ahead with the string ensemble last Sunday in line with the Victorian government announcements. So the very next day, we met at the theatre and the string ensemble performed the Lark Ascending with Markiyan, basically without rehearsal. And I think they performed incredibly beautifully. As for Markiyan on violin and Stefan on piano, they are both wonderful soloists who have had the vast majority of their work cancelled this year, here and overseas. So we were very happy to invite them to play. Both are connected to the university's Melbourne Conservatorium of Music. Markiyan was lecturer in violin for 4 years, and Stefan performs regularly at MCM still, often accompanying students. Both have been engaged to play with Corpus Medicorum's big orchestral concertos as part of the program's normally staged 3 times a year at the Melbourne Recital Centre. Now, Malcolm, I'm intrigued to hear more about your involvement with the orchestra. All the usual shows were cancelled this year, but I believe you've played many times in the past with the group. Can you tell us about how you came to be involved with the orchestra and how you have balanced your studious pursuits and your work as a busy dental practice owner in Hobart with playing the double bass over the years?
Well, before there was Corpus, there was the Australian Dental Orchestra, and before the Australian Doctors Orchestra, and before that, there was the Hobart Chamber Orchestra. And the conductor of that orchestra, Philip Taylor, his model was, in order to get an audience, and amateur musicians are always looking for an audience, was to get a charity to not necessarily sponsor the audience, but we did concerts for charities, and that charity would use whatever marketing or they had available to them to help us get an audience. So for musicians, we're always looking for an audience, and that was the model that the Australian Doctors Orchestra with Mickey Pole picked up, and I'd known Mickey for many years in Hobart already. And so I guess Corpus, when Philip started Corpus, slightly different with just doing it for the Hospital Foundation, and which of course has been very successful for him and the foundation. But I came over for the conductor,
Keith Crellin?
Martin, no, Chris Martin. Chris Martin's 80th birthday. And I came over for that concert, and that would be 10 or so years ago, and have been playing with them since. So I'm in solo practice, and it's just a case of, well, if there's a concert on, I can do with my book what I like. And but I've had occasions where I'll work till lunchtime on a Friday. I'll catch a plane at 2:00 in Hobart. I'll be at the Awaki Auditorium in Melbourne by 3:30, nearly 4:00, to take me straight from the airport with the bass, have a rehearsal in the evening, and so it's just from one thing to the other. Travelling with the bass hasn't been too much of a problem in recent years.
It seems like Corpus Medicorum players in general, being busy health professionals, are ready to step in and play repertoire, even at the last minute. I was pretty amazed by their ability to just get into the Athenaeum Theatre and record the Lark Ascending like that, with just a quick run through before we hit the record button. So it sounds like you're good at stepping in that way as well.
I've played it many times before. And yes, so the way things work with Philip is Philip just says, oh, you know, I want to put on a concert in St. Petersburg or, you know, in Milan or something. So we'll just fly over and, you know, help him out. So
sounds amazing. And I think you've also been doing quite a lot of study, maybe not so recently, but you've been playing with the orchestra for 10 years. So I guess combining the PhD study and study into the ear canal, which is an interesting choice for a musician and a doctor.
My wife's an audiologist, and back in the late 1980s, we started manufacturing hearing aids because we couldn't get hearing aids that were useful to people made in Australia. It's an interesting sort of thing. And I was the one making shells and earpieces, and when they didn't fit, I was having to make them again. So we were doing this in the kitchen at home. And she made a chance observation just about ear canal movement one evening. And when I consulted the textbooks gave a rather singular description, which was inaccurate. So I thought I'd look into it. And it probably took 6 years to put a method together. And I learned a lot about mapping tissue surfaces, mapping small objects. And when I came across the modern digital photogrammetry, digital 3D mapping from images, I knew immediately that it hadn't been applied to dentistry, or what had been applied in biological circumstances was very basic. And there was something to be done. So I worked on, there was a trick to make and I would have said, for me, over the years, what has separated dentists from doctors and all sorts of other health professionals is material science. And John Harcourt was my dental material science demonstrator in second year. And that was sort of I could say, a standout experience in my undergraduate education, because he was an expert and had just total control over all the materials. You know, you're having to learn how to manipulate and
Well, it sounds like a really interesting way to combine that interest in music, that interest in hearing, with your skills in dentistry, and just a really fascinating area of further study as well. And I'm sure there are plenty of people out there who are very grateful, or will be very grateful, to have a well-tailored hearing aid, because I think that can be quite a difficult thing to find. Now, Alistair, you have not had the complication of leading an orchestra through a pandemic this year, but you have had the challenge of leading Australia's principal dental school through it. Tell us, how has your year been, and what has it been like to run a hugely complex school from your home office, especially in the lead up to a redesign of the Doctor of Dental Surgery curriculum?
It's been different, I can tell you that. I arrived in Melbourne from Cardiff on the 17th of January and had a couple of weeks to settle. I had about 6 weeks in work, meeting quite a few people, but not everybody. And then we, as a university, went to a virtual campus, which is not ideal when you're a very practical subject and a very practical school, but we are. I learnt a lot about the school very, very quickly, and we couldn't have done what we have done, which is pretty much keep going and keep providing the education and the practical education without the dedication of the staff that we've got. What we did was move very quickly to online case-based learning. So we would actually work with our students on a setting like this via Zoom, and people that hadn't taught digitally in their entire lives, in the space of 2 weeks, flipped, and we were working online. And we could deliver case bases, so we could give digital x-rays and medical histories and complications and problems that a patient would have and talk them through. And whilst we were doing that for the first part of the lockdown, that April, May time, I was busy working with colleagues in the other very key practical areas of the faculty, which were optometry and speech therapy, audiology and physio, to make a case to the university to try and get back to some level of activity. And that would have been and was our preclinical simulation laboratories and our MOTEC in MDC, in Melbourne Dental Clinic, And then when we could, once restrictions started to ease by the ADA, seeing patients again. What I didn't anticipate was actually it going to a second lockdown and it being even more draconian than the first one. That's when I think I was very glad to have been ahead of school for 3 years previously, where I was in Cardiff, and I could actually connect to some of my old colleagues, both in Cardiff and in the UK, just to find out how they managed to do things when they were in their spring, early summer lockdown. What we did was kept going, and we've utilised our simulation laboratory a lot. We socially distanced, so we actually restructured how we would get students in. We developed a good knack, or I wouldn't say a good knack, I would say a successful knack of working 12-hour days and 3 session days for the students that will come to an end at the end of the academic year because it's not sustainable. But I'm very grateful to Melbourne Dental Clinic and the Royal Melbourne Dental Hospital for allowing our final year students the chance to work with the urgent and immediate care patients that were coming in, because that allowed those final year students the chance to actually still keep doing practical dentistry and actually seeing some fantastic patient cases. And the benefit has been they were getting one-to-one tuition, which they wouldn't normally have. And that's been a huge success. But the logistics were around being safe and making sure we had the PPE and we could socially distance. And we worked with our colleagues in health sciences and with the vet school actually to make cases to the university to allow us to come back to this face-to-face practical environment that has been safe. And we were able to not quite do an AFL bubble, but I did contact the AFL to find out how they did their biosecure bubble so that we could keep our students in placements in the regions, and we could get students into regional Victoria. We had permission to do that, so we could place them there so they could deliver a bit more care than they would normally do in Metro Melbourne. So the AFL were very helpful in saying how they managed it. And I was very grateful, not just to the university for their support, but the Department of Health and Human Services as well. So it's been a challenge, but it's one that the school has faced well. And I think the testament is really the resilience of the staff and the resilience of the students. They have had a huge curveball thrown at them this year. It's not me. I've been ahead of school for 3 years previously. Whilst it was a curveball here, and not ideal, the students really, it could have thrown them off track completely, but they really stepped up and coped very, very well. I couldn't be prouder of them.
That's fascinating that that the AFL was helpful in facilitating dentistry.
They were. I asked them how they set up their bubble, and I had an email back, which was very, very helpful. Actually, I could never have gone to the same extent they did, but it gave me. They were very, very giving in terms of what their thought process was. So yeah, it was really, really good of them.
That's great. Yeah, it certainly sounds like you've had a very busy and interesting year. We have a couple of questions from the audience now. There's actually one for Malcolm. Somebody has asked, what made you choose the double bass?
I didn't like my piano teacher. I thought she was about 80 and, she was an old something or other. She was probably about 40. And I was allowed to give up the piano if I took up the bass. And of course, the moral of the story is you keep turning up. It's a bit like dentistry. You keep turning up every day. Doesn't matter what's in your appointment book or who you think someone that you think you might prefer not to see. You just keep turning up. And anyway, so the bases. I've been doing it.
It's a great instrument too, because the body of it's not right up next to your head, so you don't get the same hearing issues that sometimes violinists and violists develop later on in life.
It doesn't necessarily require the same practice either.
Well, that's good. And Alistair, there's a question for you as well from the audience. Somebody has asked, how are you finding the dental school in Melbourne compared to Cardiff?
It's remarkably similar, and it is totally different, if that doesn't sound like a bit of a cliche. So what we do is pretty much the same as I was used to in Cardiff, but there's no doubt there is a significant difference in the level of the school in terms of its standing globally, and you feel that when you arrive. So Cardiff's a very, very good school that I've managed to take into the global top 50, but Melbourne is so well established and so well regarded, you sense that. And I think you can sense that with the broad range of staff that we've got, both our educational teaching staff and the research that goes on, and the strong legacy of research in the school. Slight differences in how we work with the hospital. It's not quite the NHS, but the more I've got to know colleagues in DHSV, it's not too dissimilar, which is very, very good. And someone asked me back home what it was like being in a country that's got all these different states. And it's no different to being in Wales, where I was, which is a devolved nation. So there are a lot of similarities that's made the transition from the UK and certainly from Wales down to Victoria easier than it might have been. But the school certainly has a significant legacy, and you can sense that when you arrive. And my job is to be a custodian of that for the next 5 years and keep the school moving in a steady direction forward.
Now, I think you've mentioned that the transition from Cardiff to Melbourne has also been eased for you personally by the fact that you continue with your interest in music and your saxophone playing. So I think we have one more time for just one more brief question. Somebody has asked, you said that you played the saxophone. Alistair, are you still playing?
I am still playing in the confines of my own home. Bit like Malcolm, I've not played a gig since I arrived in Melbourne. So my last gig was New Year's Eve 2019 with the function band I was playing with. And this is the longest I've gone without playing in front of an audience or playing any sort of concert for about 30 years. So I'm still playing my saxophone, still practicing to keep my chops in good shape, still playing my clarinet to keep the technique, because that's where the technique comes from when I play the clarinet. And hopefully once we can get released a little bit more, and we can allow to have the woodwind players back playing again, and we can get those woodwind players back and start playing, it'd be great to actually find someone to play with and find someone to perform with and play with, because it's a bit like Malcolm. It's been part of my life since I was a student and before that. So it's a bit weird not having that half of my life running at the moment.
Well, I'm pretty sure Philip Antippa from Corpus Medicorum will be very interested to hear from you about the clarinet and also the saxophone once the concerts are back on, as they should be next year. That's the plan at this stage anyway.
Well, that would be really exciting, because I think it would be fantastic to come, if I had the opportunity to come and play with and join Corpus Medicorum. It would be wonderful. As the head of school as well to join that, it would be wonderful. It
would be great. Well, I think that's all we have time for tonight. Thanks so much for joining us, everyone on the call. The concert this evening has been part of our Reunite online program, which is the dental school's way of bringing you all together to mark a milestone year since your graduation from dentistry. A lot of you have registered for your class Zoom catch-ups that will start in a few minutes. Just to remind you that your link to your session is in your confirmation email. Also, if you haven't registered and you would like to join, we are now putting all the links to the Zoom session in the chat on screen. Please make sure to click on the link that is relevant to your cohort. Thank you, Alistair and Malcolm, for sharing your insights with us tonight. Do you have any final words for our guests? Malcolm?
I've got a question for Alistair. I've heard from saxophone players that there are very interesting things that they do with their cheeks, lips and tongue on the mouthpiece. I just can't grasp this myself. Are you able to expand upon that?
Yeah, you control your breath in the same way you would in any woodwind instrument. But what you use is you use your cheek muscles to force the air through and let the air to flow through, and use your tongue to actually create the rhythmical sound on the reed so you can play very rhythmically. The trick is to keep an open windpipe so you have steady stream of air coming up through and out through the mouthpiece. And that's the challenge, and the best saxophone players can do that. And there was a trumpet player, an ex-West End trumpet player colleague of mine that I've played for 10 years with, who teaches trumpet players in the US and all the West End players now on how to relax your chops, to relax your tongue so the air can flow through and you can control that breath. But it is about keeping tension without too much tension, keeping it relaxed, and then using your tongue to create the rhythmical sounds.
I think I'll stick with the bass.
I think I'll stick with viola. Alistair, any final words for our guests?
I'd just like to say, I hope everybody's enjoyed this evening. I think it's been a remarkable success from my point of view. There's a lot of hassles with heading up a dental school, a lot of stresses, a lot of pinch points, and this year's been probably a great example of that. But there are some huge, really great perks of the job, and one of them is interacting with our alumni. And whilst we can't interact face to face this year, and I hope to meet a lot of you in person next year, this has been just a tremendous way to bring our alumni together. So I hope everybody's enjoyed it, and I hope you actually all really enjoy meeting up in the various chat rooms later on this evening, because I think these events are just a wonderful perk for a head of school to come and talk to people about. It's been a great evening, and thank you, Cecilia, for putting it all together.
Yes, thanks, Cecilia.